Risk factors of hypertension. Hypertension is elevated blood pressure that is greater than or equal to 140/90ths of a millimeter Hg. A blood pressure that is strong enough to cause damage to your organs. The reading is taken when the patient is at rest, and on at least 2 occasions, 4 to 6 hours apart. High blood pressure has many risk factors, including 1. Age. The risk of high blood pressure increases as you age. Until about age 64, high blood pressure is more common in men. Women are more likely to develop high blood pressure after age 65. 2. Race. High blood pressure is particularly common among people of African heritage, often developing at an earlier age than it does in whites. Serious complications, such as stroke, heart attack, and kidney failure, are more common in people of African heritage. 3. Family history. High blood pressure tends to run in families, being overweight or obese. The more you weigh, the more blood you need to supply oxygen and nutrients to your tissues. People who are inactive tend to have higher heart rates. The higher your heart rate, the harder your heart must work with each contraction and the stronger the force on your arteries. Lack of physical activity also increases the risk of being overweight. 4. Sodium. Too much sodium salt in your diet can cause your body to retain fluid, which increases blood pressure. 5. Potassium. Potassium helps balance the amount of sodium in your cells. Foods that are rich in potassium are important in managing high blood pressure. The more potassium you eat, the more sodium you lose through urine. Potassium also helps to ease tension in your blood vessel walls, which helps further lower blood pressure. Lack or insufficient of potassium intake in your body may accumulate too much sodium in your blood. On the other hand, dangerously high blood potassium levels will result in fatigue, weakness, nausea and vomiting. 6. Alcohol. Over time, heavy drinking of alcohol can damage your heart. Having more than 1 drink a day for women and more than 2 drinks a day for men may affect your blood pressure. If you drink alcohol, make sure you do so in moderation. 7. Stress can cause hypertension through repeated blood pressure elevations, as well as by stimulation of the nervous system to produce large amounts of vasoconstricting hormones that increase blood pressure. Factors affecting blood pressure through stress include white coat hypertension, job strain, race, social environment, and others. 8. Certain chronic conditions also may increase your risk of high blood pressure, such as kidney disease, diabetes and sleep apnea. Sometimes pregnancy contributes to high blood pressure, as well. 9. Smoking contributes to high blood pressure because nicotine causes the arterioles, capillaries and other vessels to constrict. Constriction of these vessels keeps oxygen from getting to the tissues. The constriction and lack of oxygenation cause the heart to work harder to force oxygen to the tissues, and this causes elevated blood pressure, which results in increase to your risk of heart disease. 10. Low birth weight, due to undernutrition that leads to long-term changes in blood vessel structure or function of hormone systems. Although high blood pressure is most common in adults, children may be at risk, too. For some children, high blood pressure is caused by problems with the kidneys or heart. But for growing kids, poor lifestyle habits, such as an unhealthy diet, obesity, and lack of exercise, can contribute to high blood pressure. For more information on hypertension, check out the other videos in the playlist below. I hope you have enjoyed the video. Please remember to subscribe, hit the bell notification, like and share my video. In this way, you will get notified whenever I released a new video. Thanking you.